think when a patient first comes in with a new diagnosis, it's a lot of fear, a fear of the unknown. And so in many ways, they try to go find out information about it, just like all of us do. And sometimes they turn to family and friends, and sometimes they turn to the internet. And oftentimes they come in with a lot of either outdated information or maybe information that doesn't pertain to their particular cancer. And so I think one of the things that I like to do during the first meeting is to kind of lay the groundwork of what their cancer is and to kind of give them an understanding as much as possible of what the plan or the outlook might look like. And so that takes some of that fear of the unknown away. And so I think that's helpful. It certainly doesn't answer all of the questions, and those are things that we go through together. And so I always remind them that as questions come up, to write them down and then to call us or to bring them to the next meeting. I think it's important that they know that they're not going to learn all there is to know about cancer in one day. And so we try to simplify it and then bring it up multiple times throughout their treatment course. Our job as medical oncologists is to translate our knowledge into something that a person can understand at their level, whatever level that may be. And if they're able to do that, then they're able to better assess the options laid out before them. And obviously, we're going to give our recommendation, but ultimately it's up to them to make that choice because these choices will affect how they live their lives. My grandfather was diagnosed with lung cancer about 21 years ago now. As part of that, I got to experience what it meant to have someone diagnosed with cancer in the family. And so in a very real sense, this is something that I have a passion for because it affects many of my family members. And that's where it started. So he died on my 16th birthday. And from that point on, I knew that I wanted to help people do better with cancer. Because of those personal experiences, I approach caring for people a little bit differently. And I'm constantly reminded that, yes, we're treating the cancer, but in reality, the most important part is treating the person. So I think one of the most rewarding things for me about taking care of patients is when they come in and they talk about what they've done when they're not in our office, interacting with their families, going on family vacations, making memories, those types of things remind me that we're doing a pretty good job of making sure that they're able to go live their life with cancer as opposed to it being dominated by the diagnosis. And I think that's really important for people to realize. One of the things that our cancer patients benefit from is that over the last 15 to 20 years, a lot of research has been done into why cancer behaves the way it does. And not only that, but why our immune system doesn't fight it. And we've been able to understand, in part because of research that was done here, why the immune system doesn't see the cancer cells like it should. Because of that, we've been able to bring new therapies to market that help people live better and do better for longer. My hope is that over the next 10 to 15 years, we're able to understand the immune system in a more meaningful way and a more specific way so that we're able to better target the immune system to fight the cancer. Where the future of cancer care goes is probably $1 billion or $1 trillion question. But what I'll tell you is my hope for the future of cancer care is that we're able to better treat people, and so they're better able to live their lives. And that means whatever they want to do, whatever their goals are, that we're able to better help them achieve those goals.